The human brain is an incredibly complex organ. There are changes taking place in here that we know nothing about, often until it's too late. Take me, for example. I have Parkinson's disease, a chronic, although not fatal condition that undermines the brain's ability to control the body's limbs and muscle groups. Since I was diagnosed in 2015, I've really struggled to deal with this insidious invader, and everything from walking and talking to running to eating, even breathing, is becoming more and more difficult. But there are ways to deal with Parkinson's disease, and one of them I found has made a huge difference in my life. It's called deep brain stimulation, or DBS, and it helps me with the condition that does this. Sorry. Now, there are many emerging therapies to treat Parkinson's, and DBS isn't the solution that will work for everyone, but it is one that has changed my life. I'm going to turn it back on, and as you can see, the results are almost instantaneous. The thing about deep brain stimulation is that scientists still aren't exactly sure how it works or even why, only that it does. But here's what we do know. You've probably heard of dopamine. It does a lot of things in the body. Our brain produces it to help get messages from the brain's command center to the body's muscles and outlying limbs. But in brains like mine, dopamine-producing cells begin dying off early in life. Without a reliable supply of dopamine, commands from the brain can get scrambled or mistimed. That's why people with Parkinson's sometimes shake or tremor uncontrollably, or at other times they can't move at all. Fortunately, there is a drug that treats the effects of Parkinson's. It's called levodopa, and it does a remarkable job of fending off the effects of the disease. Remarkable, but not perfect.
The problem is that levodopa is not a perfect drug. It's a very short-acting drug, and with that, the patient may fluctuate from being very good and mobile to actually declining in function. So we talk about on when the patient is responding and off when the patient, when the drugs lose their benefit and the patient is no longer mobile. And this can occur many times a day.
And there is another issue with levodopa. It's a side effect that can also be debilitating.
Many patients also, when they're on, get what are called levodopa-induced dyskinesia, or wriggling, rocking movements that most people have seen in observing Michael J. Fox on television. He has fairly typical levodopa-induced dyskinesia.
Here's how DBS helps manage some of those symptoms. It involves a clinical procedure whereby 2 probes are inserted into the brain. They are then attached by wires to an impulse generator under the skin of the chest. The impulse generator emits electrical signals down through the probes and into the brain, and that helps override some of the mechanical effects of Parkinson's. Somehow, and we don't know why or even how yet, those charges can override the tremors and reduce them dramatically. Neurologists have been experimenting for more than 40 years with deep brain stimulation to treat Parkinson's and other movement disorders. In 1997, the Food and Drug Administration in the USA approved DBS to treat Parkinson's. The treatment's been available here in Canada since the early 90s, and while it isn't a cure, it can be a life-changing treatment for some. Getting into the brain isn't easy. Doctors have to drill small nickel-sized holes in the skull so they can slide in those long, thin probes. So early one September morning, I found myself in hospital having a box bolted to my head. Not a box really, it was more like a framework, but it's meant to keep the cranium steady while doctors operate. It's an important consideration when you're having your brain skewered and you don't want to damage the useful bits. With the frame in place, I was wheeled into the surgical suite. It was a busy, busy place, people rushing around, plastic sheets being hung to create a sterile environment, and in the background, a bank of computers beeping and ticking away. All of that noise and activity was almost drowned out in my own head, at least, by the sound of the drill cutting through the skull. It was loud, but I'm thin-skulled, and it didn't actually last that long. It's a strange feeling having someone mess about in your brain while you're still awake. There's no pain, as the brain has no pain sensors. So as the surgeons slide those probes into place, it's important to pay attention to telltale signs like a tingle in your hand or your foot, or the fizz of warmth up one leg. That lets you know that the surgeons are getting those probes in exactly the right place.
Brain surgery for deep brain stimulation requires the patient to be awake. And I would say, if I were to have DBS, I would probably want it to have awake, because I know that this will guide the neurosurgeon. The neurosurgeon will have additional information to understand the recording, but also the behavioral effect of stimulation, because we can actually see the improvement as well as the side effects in the OR while surgery is happening. And this can guide the neurosurgeon in placing the electrode in a bit better.
So once the probes are in place, I was put to sleep with an anesthetic. That was so surgeons could wire up the probes to an impulse generator placed under the skin of my chest. I was then sent home to heal, and after several weeks I returned to have it all turned on. And the result was truly staggering. Here's a video we made that shows the difference of having the device turned on versus when it's turned off. When you get deep brain stimulation, they give you these two things: basic cell phone with the program on it, and this is a data collector. And if I want to turn off my therapy to illustrate what I would look like with full-blown Parkinson's and no relief from it, I would turn my therapy off. And this is going to prompt me to use this to be sure I'm doing what I want done. So place communicator and continue. I'll do that. So this is downloading information from a pack in my chest that is very much like a pacemaker. Very small, and in some cases it has a rechargeable battery. Now I can feel my DBS, my deep brain stimulation therapy, going off, and the reaction is almost immediate in that I begin to shake and sorry. And that's what it's like with the therapy off. So if I didn't have deep brain stimulation, I would have to take drugs to control this. I've been able to minimize my drug intake because of deep brain stimulation, which is good because most of the drugs have some side effects. But as you can see, if I wasn't taking medication and not taking deep brain stimulation, I would have a very hard time even taking a drink of water. And for people who have Parkinson's, it's not really a pleasant way to live. However, we do have deep brain stimulation. In my case, it works pretty well. I'm going to turn it back on, and it's communicating with this device that will now tell the pack to start. And I can feel a tingle in my heel. It creeps up my leg as the stimulation starts to take place. So those electrical impulses now are back. They're firing again in my brain as they do night and day, and overriding that impulse I have to shake or tremor. And as you can see, the results are almost instantaneous. Turns out I'm one of the lucky few. There are only about 400 of these procedures performed in Canada every year, due in large part to the limited number of surgeons available to perform it.
You have to have a good surgeon that knows how to do the procedure and knows how to put the electrodes in the right spot. But then after the surgery, you need an expertise in doing all of the programming and adjusting the stimulators, and also adjusting the medication doses, which typically change after the operations. It's the neurologists and the nurses after the surgery that are doing a great deal of the work in optimizing the responses.
The good news is that DBS is becoming more common. The bad news, it doesn't work for everybody with Parkinson's. People who have underlying conditions, or who don't respond well to levodopa, or who are simply too old, will have to look elsewhere for relief. Forestell here at CBC Television. How are you? Great. For me, regaining motor control of my body has been nothing short of a miracle. I've managed to cut my medication intake almost in half. My doctors tell me DBS could provide me another 10 to 15 years of relative tremor-free living. I would have been happy with just 5. Wonderful. Thank you very much, Monsieur Caron. Good to speak with you. I haven't beaten Parkinson's, not by a long shot, but Parkinson's hasn't beaten me either, and that's a standoff I can live with.